With the cost of Eliquis being so expensive and the unpredictability of whether or not you're going to use it, especially with it being prescribed more and more to Medicare beneficiaries, how do you select the Medicare Part D plan that's going to work for you? And if you're already on the wrong Medicare Part D plan, what can you do? In this video, I'll go over the Eliquis, when it's usually prescribed, and what to do if you are on it and you need to figure out if you should use a coupon card, if you should use your insurance, or apply for any kind of patient assistance program. All right, first, Eliquis is a medication that is usually used when you have AFib to prevent heart attack and stroke. One of the main reasons why it's used more than other medications is because it has very low side effects. Now, I'm not a medical practitioner and I have no idea whether or not your doctor is going to prescribe it, but the trend is more and more Medicare beneficiaries are being prescribed it as a preventative measure for heart attack and stroke. And many Medicare beneficiaries who have had a heart attack or stroke have been prescribed this medication. The retail cost for Eliquis and a typical 1 month supply comes in about $600. And if you can see here, Eliquis actually has been increasing in price 6% in January of 2022, and it's probably going to increase more as time goes by. The patent for Eliquis in use for many of the things that it's prescribed for does not go away until November of 2026. What that means is no generic can be prescribed for what Eliquis does for you. So the availability of generics aren't going to be coming anytime soon, at least in the next 3 years or so. And even then, Eliquis could apply to extend their patent protection. And of course, we all know that some generics don't work as well as the brand name due to sourcing and other factors. Next, so what can you do if you're on a Medicare plan, or on your Medicare plan, your medication is very expensive? First, I'm going to say check with your Medicare agent and make sure that after running the numbers, it is truly better to use a coupon card than using the insurance. And I'll go over the insurance portion right after this when I summarize the coupon card. So I use 3 different sites to calculate which coupon card might save you the most money. There are tons of different ways to save money using coupon cards, but I narrow down to these 3 services. So the first is SingleCare, and for this particular location, which I ran in Honolulu of Hawaii, and for this drug in this zip code of 96813, Walgreens on SingleCare has the best rate. You can see you can just get the free coupon. The best thing to do though is to call the pharmacy and give them the BIN, GRP, and PCN number. Well, what the heck are those things? So if you click here and get free coupon, it will generate this, and you just call the pharmacy and see what the price is when you use this coupon card. The other 2 websites I use are CleverRx, which is here, and GoodRx, which is here. Now, GoodRx has recently, because they do so much marketing and advertising, their coupon prices have not been as good as SingleCare or CleverRx. I would implore you to check the links down below, and you can go ahead and have all those apps available for you to use when getting any kind of new medications. Now, what about your insurance? I mean, that's why you picked it up in the first place, right? So on the insurance front, here you will see that the estimated drug costs are going to change based on the plan that you picked. Obviously, depends on the formulary. Unfortunately, you could get a heart attack mid-year, and unfortunately, you can't change your drug plan mid-year. So what you would need to do in this case is to figure out if by adding this drug to your formulary or to your cocktail of Part D drugs you use your insurance with, if that's going to negatively impact you getting through into donut hole, and whether or not that's good or bad for you. What does that even mean? So Medicare Part D is kind of like a mountain. So all the different parts of Medicare is a different mountain that you have to climb. Part D has a different mountain depending on the type of Part D plan you pick. Typically, a higher premium means that the mountain won't have as many surprises, cliffs, steep uphill or steep downhill, or canyons that you have to jump over. When you're dealing with Part D, you can buy down those things by paying a higher premium, but not all the time. So what can we say about the drug plan? So in the area code or zip code of 96813, you'll see that the plan that saves the most money costs $71.40. And this is going to be skewed because it only runs this estimation from June to the end of the year. If we had this from January to the end of the year, the data would be much better, but due to the limitations of the software, it can only run from the next available enrollment period to the end of the year. So with just Eliquis, on this plan, it would only cost $329 for the rest of the year. Pretty amazing, right? But it costs $71.40 per month. So you're paying down this high cost of the drug. So if we go down to check the most expensive drug cost, we go all the way down here and we find $2,400. Now that's a huge difference, right? $300 to $2,400. How does that work? Well, all these plans cover this medication, which means that they're on formulary. Just depends on which tier they're on. Remember, Medicare Part D has a tiering system for all their medications, and each individual insurance plan has a different tier for the medications that are on it. All these plans cover Eliquis, but all these plans cover it at a different amount, even within the tiers. Okay, so what should we do? Buy the most expensive plan? Not yet, because if you look, this plan is $47 a month. Not much less than the $71 plan, but yet you're paying $1,400 a year for this medication, right? And this one's only $5 and you're paying right around the same amount. So really what this goes to show is you have to be really in the kind of know when you're working with your insurance plan coupon cards. And there is just one more route. I'm going to show you here in CleverRx. So I don't know if you folks caught this, went really fast, but in the patient assistance program, so if you meet certain financial criteria, which for Eliquis is going to be, I think you have to go to their website to check, but typically it's around 250 to 300% of the federal poverty level. Then, by providing your tax return and the prescription to the Eliquis patient assistance program, you would be able to get this medication for as little as $50 per month, which is the best route if you are at that limited income. Now, patient assistance programs, their eligibility can close, meaning they can run out of this subsidy for you to use. Also, the subsidy only lasts for 1 year. So what that means is even if you qualified this year for the Eliquis subsidy, you have to apply every single year. And with Eliquis being prescribed more frequently, more people are going to start applying for these. So please apply as soon as possible. All the links that I talked about will be down in the description below. You guys have a great rest of the day. I hope you folks enjoyed this video, and if you have any other medications that you were concerned about or that you were confused about, please let me know in the comments down below. Also, I will be starting a private Facebook group for Medicare beneficiaries who have questions like this so that we can kind of have a more deeper discussion, longer discussion, or more detailed discussion on your specific situation and what coupon cards and things you can use in your specific scenarios, in hopes that I can help more people in this specific space. Again, thanks for watching. Folks, have a great rest of the day, and I'll see you in the next video.